Hi, I'm Paula Nutting, your musculoskeletal specialist. And today I'm addressing something that's quite important for probably more the females than the males out there in our client base, but one of that rectus diastasis or diastasis recti, which is a common split that many women have during pregnancy. So all women will mostly have some kind of split between the abdominal muscles that will give us quite a clean pathway where we can drive fingers down. Now that's happening because there's not as much space as the baby's growing and developing. Now in about 20% of women, that diastasis recti does not heal and close over. So we want to try to find some really good tips for postpartum mums to be able to help and assist get their tummies back into something that's functional. It's not about how pretty our bellies look, ladies and gentlemen. It's never been about that. It's about form and some kind of stability for our anterior part of the body. So please don't see this as a video that's something about how we want to beautify ourselves, because it's never ever about that. Now if you have a client, this is going to be really the early start stages. I just want Kevin to roll the legs from side, and you're going to do this at home, to side. And most people use this exercise as a lower back mobilizer, which is fantastic. And doing it like this, without using much mindfulness, is exactly how that's going to work. But I want you to tweak it up a little bit. So this is really more instructional. Let those legs roll away from me, Kevin. So from that position, I want you to focus on contracting these abdominals, so laterals, obliques, to bring those legs back up for me. Up you come. So the focus is now actually drawing from the anterior lateral part of the body and squeezing through here. There's a little bit of a wobble, isn't there? Yeah, so go over that side. We know there's a pathology on that left-hand side, so that squeezing in and coming my way. And I want you to try this at home, because you'll find that there's really quite a significant change. With some people, I can see Kevin's trying to hitch up through here. He's trying to do that. So if that's happening, when he's coming through range, just get her to more think about using part of the lower limbs as a pivot point for that. So stay over here. I want you to concentrate here, but try to bring your knees so they're going towards, more away. Perfect. So that's a really easy first stage. How are we going to tweak it up? We're going to get them to do that till they feel really comfortable and in control. We're also going to include our Kegels or any pelvic floor work that they need. And then we're going to get them into that dying bug. Now the dying bug is simply going to be arms up for me and legs up. So the arms and legs are going to be sitting pretty much vertical. The knees stay bent. Please don't have them extending out when they go through range. And we're going to take one leg, opposite limb, and they're going to extend. Yep, and then back. And then we're going to use the opposite. So if you're looking at this, the keys here are complete stability. Keep going for me, Kevin. These two do not move. And then these two don't move. And what we're actually doing is we're giving really good diagonal obliques, rectus, serratus anterior, some latissimus dorsi as he goes through range, and of course our transverse abdominis. So you're going to get your client to do that probably about 30 seconds and then build it up to 60 seconds. We want to make sure that they can do it prior to fatigue. If your client is starting to fatigue, starting to arch up through the back, then we want to stop straight away. If there's presence of pain, I want you to also stop. We need to seek medical instruction and get a clear tick of approval when we work through any of this stuff, especially if they've got, say, a 3 centimetre split in the abdomen. Try that, give that to your clients, really good for pelvic floor stability as well. I'm Paula Nutting, your musculoskeletal specialist.